The 3D Organon cutting-edge medical anatomy platform provides two applications: virtual reality anatomy, which is designed to support PC-powered VR headsets and standalone VR headsets. And of course, 3D anatomy, which is designed to be used with desktop, laptop, and tablet mobile devices. At this point, and before we move on to the gritty details, we are proud to inform you that 3D Organon is also the winner of the prestigious EdTech 2021 Awards for the best virtual and augmented educational solutions. More recently, was awarded the Muse Creative Award 2021 in the experimental and immersive virtual reality projects category among 4,876 entries from all over the world. And just this week, just the other day, we were awarded the Impact Byte Awards 2021, promoting technological innovation in the specialized sectoral applications and training category. Wow. 3D Organon is the leading extended reality anatomy platform. It is the first and most advanced VR anatomy solution for medical education worldwide. 3D Organon has a multimodal approach to teaching and learning of anatomy. The content of 3D Organon VR Anatomy Software, which has been designed and created by anatomist professors and medical professionals, is original and based on extensive research-led investigation of scientific literature. The software application contains high-detail 3D models. 3D Organon VR Anatomy incorporates fundamentals like engagement, immersion, enjoyment, interactivity, and of course, motivation that lead to a high degree of knowledge comprehension and retention. The extensive knowledge base of anatomical terminology and definitions in the software application is translated in an unprecedented 16 languages now. This is an attractive and effective feature for the international students at your institution. Dutch is the latest language to be included in the 2022 release. 3D Organon is available on almost all VR devices, including the latest standalone VR devices available to date, such as Oculus Quest 2 and HTC Vive Focus 3. 3D Organon is the world's first anatomy app to support virtual reality headsets. We embrace all the cutting-edge technologies in the XR ecosystem. You can use virtual, augmented, and mixed reality and increase your students' motivation to boost learner engagement. 3D Organon VR Anatomy provides a wide range of use case scenarios and allows you to use the most appropriate scenario based on your resources and curriculum or course requirements. The student can use 3D Organon VR Anatomy software for self-directed learning, to tutor oneself, demonstrate, understand, and learn anatomy. Here, he's using the PC-powered VR headset to explore the anatomy content, and by default, you can also see the content on the PC screen. In a small room with 1, 2, 3 students, for example, 3D Organon VR Anatomy software can easily and effectively fit the purpose of student or educator-led small group teaching. Here we can see students testing their knowledge in clinical cases using the interactive USMLE-style quiz questions. In an educator-led large group, the lecturer can present the anatomy class in a large group session or in a lecture theatre. The educator here is using a VR headset and projecting 3D Organon VR anatomy content onto a big wall screen to demonstrate the anatomy content. With the multi-user cross-platform implementation, you can enable interstate and overseas students to experience the tangible benefits of immersive 3D technologies via online virtual classrooms where anatomy is demonstrated live and students are able to explore with cross-platform device support. Here, the professor has opted to use the multi-user cross-platform session to deliver his anatomy session with his students using standalone VR headsets within the lab for an in-class session. 3D Organon VR Anatomy can be implemented on university library VR workstations as a great source for anatomy learning for students and their self-directed study. Museums are also rapidly employing 3D Organon to enhance their exhibit portfolios. 3D Organon VR is empowering patient-centered education by helping doctors visually explain the appearance, the position, and relationships of body structures to patients. The more clearly a disease, the therapy or the operation is understood, the more likely it is that a patient will be comfortable with their care and adhere to necessary regimens. 3D Organon VR Anatomy can be effectively used by surgical trainees and surgeons for surgical training and planning in order to revise the anatomy of the area or to plan and revise the procedural steps. This will result in better preparation of the surgical treatment procedure that will lead towards improved patient outcomes and ensure patient safety during surgeries. Using 3D Organon VR Anatomy for surgical planning and training offers a safe learning environment and can even be conducted remotely, which is less time-consuming and more cost-effective. Here we're in an anatomy lab during cadaver dissection, where you can see groups of students working at different workstations next to cadaveric dissection tables. One student is working on 3D Organon VR Anatomy using a VR headset, while the others are working on the real cadaver and then compare the structures in the 3D anatomy model with the structures in the cadaver in real time. You can also use mixed reality VR headsets. You'll be able to switch to mixed reality mode and see all the 3D models and anatomical structures directly in your environment. This offers unique use case scenarios, as you can see your patients or students who are wearing the headsets. You can also superimpose the 3D models directly onto the cadaver and make your structure comparisons or onto the body parts of your patient. You can use 3D Organon VR Anatomy for your clinical skills sessions, revise anatomy before and during physical examination workshops, and demonstrate surface anatomy. In the example you can see below, we see the 3D Organon anatomy content being cast onto a large screen and students rotating to various workstations with mannequins, plastic models, etc. These are examples of modern VR labs from universities in Australia, to give you an idea how they've been set out, and of course, universities in China. The students here are using 3D Organon VR Anatomy to conduct a pre-read, let's say, before the actual cadaver dissection described earlier on. When you launch the software, you enter the 3D Organon VR environment. Welcome. You find yourself in the virtual lab surrounding where the first scene you see is the 3D Organon skeleton. He is a familiar face, figure to us all. Slightly to the left of the skeleton, you have the main menu panel with all the illustrated icons that represent all the 3D Organon features and functions available in the application. The right column includes features like system-based anatomy module, which includes the 15 body systems, as you can see, being pointed at the moment, consisting of over 10,000 realistic anatomical structures. Regional anatomy, microscopic anatomy, body actions, the quiz, and the environment. And to the left-hand column, we can see the menu, the network, the help, the record function, the tools feature, and the favorites feature. It has been, the whole environment has been ergonomically designed to be user-friendly and readily available and easily accessible at the end of your fingertips via your VR controllers. It's simple as that. With the multiple environments, you can choose the background that suits your teaching or learning style better by switching among 4 different environments in VR. virtual lab, light, dark, and your real environment in mixed reality modes. The 3D Organon VR Anatomy platform includes an extensive knowledge base of anatomical definitions available in multiple languages. In the menu function, you can select a primary language and secondary language, so you can have two languages simultaneously. This is an attractive and effective feature for institutions that conduct courses in more than one language, and also for the international students at your institution. The network feature enables educators to host immersive real-time virtual rooms to suit on-campus or remote delivery of anatomy teaching. By creating an immersive real-time virtual room, the educator can have a multi-user cross-platform session with students able to join from institution devices or their own devices from any location whatsoever. This will allow them to follow an online or in-class anatomy session in real time. Here you can use the microphone to voice chat to the student or write text. It's so simple. During the pandemic lockdown, the multi-user cross-platform literally saved the day for hundreds of institutions around the world by allowing them to continue delivering their courses and serve the curriculum. And we are proud of this. To explore some of the astonishing things that you can do with a model, let's choose the whole muscular 3D model from the muscular body system from the regional anatomy system. The controllers serve the user for all positioning of the model, like vertical and horizontal rotation, panning, scaling of 3D models, and much, much more. So let's explore. Here we're going into the regional anatomy. We've decided to use our whole muscular model. Here you can see we can rotate the model. You can move the model up and down along the vertical axis and position it as desired. You can scale the model to the right size. Some panning, more rotation, of course. You can scale up and reposition 3D models for an enlarged view of any object, large or small. You can perform a virtual dissection by grabbing and moving anatomical structures into the virtual space and venture into the inner layers and structures of your model. This is absolutely amazing. This allows you to really appreciate the spatial relationships between anatomical structures. You can identify the anatomical structure you're interested in and view the anatomical terminology. You can walk around the model and you can enjoy the absolutely breathtaking walking experience. Just look at this. Close-up visualization of any anatomical structure is now an amazingly immersive experience with 3D Organon VR Anatomy. The system-based anatomy approach in 3D Organon is designed to provide learners with the overall anatomy of the human body. Regional anatomy allows you to explore anatomy based on region of the body and emphasize the relations between various systemic structures in that region. The module consists of hundreds of pre-configured scenes of popular anatomy views. You don't have to build your anatomy model from the ground up, but instead you can choose the predetermined model based on the body part you are interested in. With microscopic anatomy, you can present detailed anatomical models of important organs and tissues at a microscopic scale in a unique way. The 3D Organon extensive database of full-thickness 3D models enables a stratified histological analysis by providing a true depth perspective and transforms teaching and learning into a highly efficient procedure. The regional anatomy system, which is available in both the 3D Organon Anatomy for standalone VR and PC-powered VR, will be used today to demonstrate some fantastic examples of our 3D models and scenes. So hold on to your seats, you're in for a tour. A good example is the cerebral arterial cycle, commonly known as the circle of Willis. The circle of Willis is critical as it's the meeting point of many important arteries supplying blood to the brain. Structural differences in the circle of Willis are common, and the classic complete anatomy of a circle of Willis is in fact only apparent in a minority of cases. Therefore, explaining and understanding the circle of Willis may be difficult, and this is where 3D Organon VR Anatomy can help. This is why we chose this model to start off our exploration. So let's select the circle of Willis from the nervous system from our regional anatomy module. You can scale, you can rotate, you can position your model at the desired angle. You can perform a virtual dissection of the model by literally grabbing structures and placing them into the virtual space. This is your field. You can simply reset the work you're doing and start your next task by scratch. When you start selecting and identifying any of the thousands of anatomical structures from your 3D models, the option panel to your right appears which provides you with the definition and anatomical terminology of the structure. From the model, you can remove or isolate entire scenes of structures that are relevant to the model in order to examine specific anatomy structures of interest. The option panel also includes a range of other effective modes and functions available to you. The hide function, which allows you to subtract structures from the scene and delve into the deeper layers of the model. Again, we just simply reset and move on to our next task. Again, dissect the model by simply grabbing the structures, move them into the virtual space, and rotate the model to any position and angle for a better view. And look at this. Simply grab any specific structure and bring it closer to you for a close examination. It does not get any closer than that with any other digital resource. Use the flag function to view the anatomical terminology of a structure. You can easily turn the terminology labels on and off, which is great when the educator wants to ask his students to identify structures and test their knowledge.
Right.
Did you hear that? The sound function, which allows you to listen to the anatomical
right.
terminology. With the cadaveric images module, you can enrich your anatomy courses with supplementary learning material from multiple real-life dissection images. You can explore hundreds of cadaveric images, familiarize with all body areas of systems and structures, and reference them with your 3D models. Simply select the structure, identify it. This allows you to enjoy the most interactive experience as if you were in a dissection lab in a real-world environment. Another exciting model of the hundreds available in the regional anatomy module is the heart and thorax model we've taken from the heart-body system. This is absolutely amazing. Move it to any desired position and angle you want. And here we see the user selecting and identifying the heart. He'll start removing structures like the pericardium, more structures. He can move further into the model. Here we see him remove the tricuspid valve, the left atrium, and eventually completely dissect the heart. Simply reset, and on you go. No other anatomy resource can achieve the level of immersion, interactivity, and engagement experienced with the 3D Organon VR Anatomy software. Again, some more cadaveric images. In the cadaveric images feature, Here you can access the wide list of cadaveric images related to the selected body part system under examination. The option panel also includes other functions such as fade mode, where you can make the structure semi-transparent to emphasize the location, borders, and relationships with other structures. And of course, clinical correlations, where students can familiarize themselves with common clinical correlations and manifestations organized in body systems. The module enables quick access to essential knowledge on a wide range of pathologies. The bone mapping module in 3D Organon offers a detailed color mapping for each bone of the body organized into parts, borders, surfaces, and landmarks. The module details over 3,500 bone features and landmarks presented with appealing colors and highlights. The following video on the vertebral column anatomy is an excellent example of using 3D Organon VR Anatomy for teaching and learning anatomy and in the study of orthopedics and osteology. So let's explore. Welcome to the 3D Organon VR environment, where you are greeted by the main menu. From a wide range of 3D models in the skeletal system, we've selected the vertebral column, for example. Identify vertebrae and other structures and move them into the virtual space for detailed and in-depth exploration and examination of your teaching and learning purposes. You can literally grab structures and virtually dissect your model. You can just take it apart. Many vertebrae levels are associated with significant anatomical landmarks and structures. You can demonstrate to students all parts of the skeleton in precise detail and quality by using the bone mapping, displaying fully selectable colored maps of the surfaces, borders, parts, and landmarks on each bone has become the simplest and most entertaining tasks ever for both the educator and student alike. There's the option box again, featuring all the functions and features you need that we explored earlier on in our previous model examples. And here we're constructing and deconstructing your anatomy model is interactive, engaging, easy, and fun for both the educator and the student. The power at the end of your fingertips with the VR controllers is absolutely amazing. You can walk around the 3D model, and you can even put your head inside the model, the body, and enjoy that fantastic walk-in experience. And that's only one anatomy model from the skeletal and other systems we have explored so far. We have 15 body systems in total, with hundreds of such models. Just think of what you can do with all this anatomy content in your course. This is a short video presenting a right kidney dissection using 3D Organon VR Anatomy, created and presented by Dr. Fabio Reina, Professor on Virtual Reality at Francisco Marroquin University. I need not say anything. Actions speak louder than words. So just simply observe the amazing things he's doing with the functions and features that are available to him with 3D Organon VR Anatomy. Here he's applying the pain tool, the pain effect. He's dissected his model. These are more tools. Here he's using 3D painting for bone mapping. This is not a demo. This is material from a real university anatomy class. 3D Organon Microscopic Anatomy is the only microscopic anatomy module available in a VR platform in the world. It is nothing less than impressive. We've chosen a few, just a few, to show you. Here you can see the skin microscopic module. You can close up, explore, identify structures. The bronchial tree. Here you see we've also changed the environment, the surroundings, to a black surrounding, just to give you an idea of all the different combinations of functions and features and tools you can use for your presentations, your lesson plans, and so on. This is the absolutely superb microscopic ear model. Just enjoy it. I won't say anything at all. System-based anatomy is available in the PC-powered VR version of 3D Organon VR Anatomy. PC-powered VR headsets are those which require connection to a computer graphics card, making it possible to support the heavy content of the 3D Organon software application. What we are doing here is constructing the human body model, starting from the skeleton and adding all the body systems, all the 15 body systems available. We're using the gender selection function for real-time switching between male and female models, adding some more body systems, and finally arriving at the integumentary system. This is our completely dressed 3D Organon model. It's system-based anatomy serves as the building block for students to develop a thorough understanding and master anatomical correlations and positioning. Of course, you can also work backwards from the example we showed you, and you can also concentrate on the various combinations of body parts that interest you. Make the most of the human body actions module, featuring over 550 real-time animations of the joints, muscles, respiratory, cardiovascular, reproductive systems, and sensory organs. 3D Organon is the only platform that supports body actions in all XR experiences, VR, AR, and MR. Here are some examples, just to name a few. The rectus abdominis muscle from the muscles of the abdomen. Or the gracilis muscle, displaying flexion of the hip joint. And these are just 2 of 550 real-time animations. Each movement performed by a muscle is displayed and labeled separately for that superior teaching experience. That applies for all the animations. With the formative assessment module, your students can teach their knowledge in identifying anatomical structures with a clinical anatomy, USMLE-style interactive formative assessment. 3D Organon is the only platform which includes real-time assessments in all XR experiences, VR, AR, and MR, in immersive learning environments. The intuitive way the formative assessment is done is unique to 3D Organon. This is one of the questions with its distractors. The quiz module offers an innovative assessment method due to the requirement for the students to have to explore the 3D model and then select the correct answer option. Here we see the correct answer, which is also displayed with the model, the transparent model, showing you the correct answer. The analytics feature provides a history for your performance in past quizzes. This allows you to gauge your progress and learn from your mistakes. Valuable feedback can be drawn from the analytics. Save your models in the favorites function for quick access. Let's look at some examples. From the respiratory body system, for example, we've taken the lower respiratory tract model and performed all the planned manipulations we wanted. Then we just save it to favorites. It's a very simple task. All your actions, your model have been saved into favorites. Likewise, another model is the female rectum from the digestive body system that we selected, just to give you an idea of more models that are available, of the hundreds and hundreds. Here again, we perform all our tasks for our purpose, teaching and learning purposes, using all the functions and features. And again, with a simple movement, simple task, we can save that to our favorites. This is just another model of the lower limb taken from the muscular body system, again from regional anatomy. We perform all our tasks, and with a simple press of the save button, we've saved them to favorites. And now we've just recorded them. This is a great way to prepare your 3D models, save them in the favorites feature, record the saved models, and implement them in your lesson plan or presentation. It's simple as that. Star is another feature that helps you save your material. It allows you to select the tile with the predetermined model you want from the regional anatomy module and save it in your custom favorites list for quick reference. It's also simple. Just click on the star on the left side of each icon of your pre-configured models in your tiles, and it's automatically saved for instant recall and quick access when required. Here we're showing you some indicative models, how it's done. It's simple. And there they are, saved, ready for you to recall at any given moment. We've just opened a few for you to have a look at and explore and get an idea of what 3D Organon VR Anatomy is all about. Great. The help function contains a menu of detailed and comprehensive short videos that provide guidance and help on how to use the features and functions of the software application. And that's not all. I would like to emphasize that 3D Organon, we do not take customer support lightly. We offer, apart from this help feature within the anatomy content, we also offer technical consultation, free trials, demos, training sessions, and our amazing customer support team is always keen and available to offer assistance and support whenever needed and in a timely fashion. We are partners in our endeavors, and we do not take this, we take this very seriously. 3D Organon VR Anatomy provides a range of tools that can easily be used to explain and help in better patient understanding of both the healthcare issue and the treatment. And likewise, the tools are an effective and efficient resource for surgical planning and training also. Use a 3D painting tool to teach and learn surface anatomy or for organ mapping. Your VR controllers are your brushes, and the 3D environment is your canvas. Great for demonstration purposes. The tumor growth tool is designed to help you demonstrate cancer and growth development and spreading directly onto the models of tissues and organs. Simulate the effects of bone inflammation and osteoarthritis with the Bone Spurs toolkit. This tool is ideal for clinicians who want to explain the mechanism of joint pain or swelling to patients. The Pain Effect tool helps you place colored glowing spheres at custom locations onto anatomical structures and organs. These effects are useful in demonstrating pain points or regions that demand learners' attention during teaching. Clinicians We'll favor this repertoire of resources in patient education sessions. The amazing slicing or sectioning tool. Sectioning of the human body will give you an insight into the relationships between anatomical structures. You can section the 3D model from any angle you want in real time with the slicing toolkit. Clinical and surgical procedures can be easily explained to students and patients, of course, as structures are cut away on a modular approach. The split apart option will create spaces between cut structures useful for illustrating nerve and vessel pathways. I would like to emphasize at this point that each year, 3D Organon releases a new edition with amazing new models and features. In just a few weeks from now, we will be releasing some exciting new developments, so I highly encourage and recommend you to stay tuned. To give you just a sneak preview, the 2022 edition is coming in the third quarter of 2021 with absolutely amazing features such as imaging. All I'll say is that it will act as an application of the knowledge of anatomy in clinical imaging, as well as a learning tool for students and health professionals studying anatomy. Histology slides, pathology images, refactored animations, new VR environments, the new VR search tool, the new microscopic models with absolutely beautiful graphics. Here you can see the multipolar neuron, which will help students understand how the neuron is structured, the karyotic cell, all the information and details you need to know about the cell are there, readily available for you. The new eye model with 97 different objects in the model. You can see the anterior chamber, all the details you need to know, including the arteries, the veins, the vessels, the cranial nerves within the orbit, and much, much more. And to save the best for last, ultrasound simulation for educational ultrasound training. We at 3D Organon are so excited about this, and we cannot wait to show the world. Virtual reality VR simulation provides users with an immersive 3D experience that can be used to allow trainees to practice skills and operations in a safe yet realistic environment that does not compromise patient safety. Traditional ultrasound training is normally delivered using large, costly, and often quite advanced cart-based systems. Improving safety, quality, and education in healthcare, the 3D Organon ultrasound simulation is designed to demonstrate functional anatomy to students and provide training for the future medical doctor. Imagine the competency levels in ultrasound to be achieved by our future doctors when entering clinical practice. We are using virtual reality technology and 3D Organon Anatomy together as an ultrasound simulator. To the right, there is a clicking plane where you can see the anatomical structures, and to the left, there is the simulation window where they can see the simulation view of the 3D model. There are probes such as curved, linear, and cardiac, which are simulated by the controllers and allow you to visualize anatomy, the arteries, vessels, organs, and many, many more structures. As we speak, 3D Organon is being trusted by hundreds of top-tier universities worldwide in Europe, the United States, Asia, Australia, the Middle East, and many, many more places. We look forward with excitement to joining your institution also and making you a valuable and cherished member of the 3D Organon community. For any questions, inquiries, more information, to get your free trial of the 3D Organon Anatomy VR software solution, please do not hesitate to get in touch with us at prosupport@3dorganon.com. Either myself, Theo, or my colleague, Christina, in Australia, we're more than happy and glad to offer our assistance and help. You can also visit our site at www.3dorganon.com. Before I wrap up our webinar, I would like to share with you two very interesting quotes that I recently came across and would like to share with you. Virtual reality is the natural next step for the evolution of medical education, and also the future of education in which VR plays an important role is technologically advanced, efficient, and exciting. Let's all be part of that environment.